Hello, I'm Dr. Purnima Ramanan, an infectious disease specialist. I'm going to walk you through what you need to know about preventing infections post-transplant. Because you've had to take anti-rejection medications as a transplant recipient, you're considered an immunosuppressed individual. This means your immune system is weaker than that of the general population, and you have a significantly increased risk of developing certain infections. To combat this, you will be asked to take anti-infective medications to prevent some infections following your transplant. It's very important that you adhere to these recommendations. There are two ways to prevent infections following your transplant. The first is giving you antibiotics before you acquire an infection, and the second is updating your vaccines. Your risk of getting certain infections is dependent on the type of transplant you had. Remember that as you move further out from your transplant date, your infection risk does decrease slightly. However, you will always be considered an immunocompromised individual for the rest of your life because you will always require some form of immunosuppressive medication. The single most important thing that you can do to prevent infections is to wash your hands frequently. This includes before and after all meals and after using the restroom. You can use soap and water or an alcohol-based hand sanitizer if your hands are not soiled. Your risk of acquiring respiratory infections may be reduced by frequent hand washing, avoiding close contact with persons with respiratory illnesses, avoiding crowded areas such as shopping malls, and other dust-laden environments such as construction sites. Here are some do's and don'ts to prevent foodborne infections. Wash all raw fruits and vegetables before eating. Avoid eating raw seed sprouts. Don't eat raw eggs or raw or undercooked meats, and avoid raw seafood, including raw oysters, mussels, clams, sushi, or sashimi. Do not drink unpasteurized milk or eat cheeses made with unpasteurized milk. Avoid eating from public salad bars or buffets or street vendors with lower hygiene standards. Do not drink well water or water directly from lakes or rivers. When traveling to countries with poor sanitation, avoid drinking tap water or consuming ice cubes. Please ensure that your pets are healthy and up to date with their vaccinations. Avoid cleaning litter boxes, bird cages, and handling animal feces. Avoid exotic pets as well as reptiles and amphibians due to higher risk of salmonella infection. Avoid use of hot tubs, especially public ones. Don't smoke marijuana or use any street drug. Marijuana use has been associated with severe fungal infections in immunocompromised persons. Always use latex condoms during sexual practice outside of long-term monogamous relationships. Don't share towels or face cloths, and don't share glasses, water bottles, or eating utensils. If you are planning international travel, please seek counseling with a travel clinic regarding vaccinations and any prophylactic medications that you might need. It's also important that you keep your vaccinations up to date, including inactivated influenza vaccine each fall, tetanus booster every 10 years, pneumococcal vaccines, hepatitis A and hepatitis B vaccines, as well as vaccine to prevent shingles. Make sure you do not get any live virus vaccines after transplant. Examples of live virus vaccines include measles, mumps, rubella vaccine or MMR, Zostavax or the nasal influenza vaccine. All household members should be up to date with recommended vaccines, including seasonal influenza vaccine. I know that's a lot all at once, so as always, we are here to answer any questions you may have. To learn more, visit uchealth.org/transplant.